Hello, my name is Dr. Gary Esses. I'm an assistant professor of pain medicine and anesthesiology in the Department of Anesthesia at Mount Sinai Brooklyn. Today, I'm going to be talking about pain management and how we can help you. So the first question I'm going to answer is, what types of pain do you treat, and what are some common conditions where pain management is effective? So I'd like to say that we can treat pain from head to toe. So starting with the head, we can help you with headaches, we can help you with neck pain, low back pain, any kind of joint pain, including your shoulder, your knees, your hips. So there's a lot of options for you, and those are pretty much the common conditions. If you've ever heard of something like arthritis, we obviously can help with that, or sciatica, which is another common pain condition. Those are the types of things that we can certainly help when it comes to your pain. What are some typical treatment options? So typically what will happen is you'll come into the office, we'll do an evaluation, and we'll look to see what makes the most sense for you. Oftentimes, patients have tried medication over the counter on their own. I certainly can come and offer other medications that may be helpful, like anti-inflammatories, or sometimes pain specifically for nerve kinds of pain that you may have if you have sciatica and there's nerve pain shooting down your leg. If your pain is more significant or has been around for a while, there's other options that are very much indicated, including injections. So we can do nerve injections. We can do something called an epidural injection, which is kind of like a cortisone injection. We can also help you in other ways with even some newer techniques, including spinal cord stimulator, where we kind of use electricity to help stop the painful signals coming to you. And we can do things like platelet-rich plasma or stem cells, which are ways to regenerate certain parts of the body, specifically where you may have pain. Are there other treatments for the cause of my pain besides medication? So as I was mentioning earlier, if we were to get more in depth into what we can offer for you, injections are usually the best way that we can help your pain if we are not successful with just medication. Those injections can include coming in and having us use either X-ray or ultrasound to find the location of where your pain is coming from, and then deposit some medication there. Sometimes it can be a steroid that can help with helping the inflammation and calming down the nerves that are causing pain, or using numbing medication, similar to a Novocaine that you might get at the dentist, to also help you decrease your pain. Do other medical conditions, i.e. diabetes, high blood pressure, impact treatment? So when it comes to pain management, it turns out that very rarely do your other medical conditions get in the way. Now, if you are on blood thinners, that can be a problem for some of the injections, but by and large, we have options for anyone, no matter what their medical conditions might be. And I'm very happy to work on a very tailored and unique treatment plan for you if you do have multiple medical problems. How do you establish goals for managing my pain? Well, first off, I would like to say that it's important to understand how the pain is affecting you. Are you having issues where it's stopping you from doing things you love to do, like going out for a walk or playing with your grandchildren? If we can come up with a specific reason for why your pain's bothering you, obviously we want to get rid of the pain, but also we want to get you back to what you were doing previously. And so to set a goal for you to get back to doing the things you love to do is part of what we're trying to do, in addition to obviously getting rid of as much of the pain as we possibly can. What types of diagnostic tests will be ordered? So for pain management, we typically do imaging tests if we're going to do any diagnostic tests at all. We don't really do blood work in pain management. What we're really looking to do is if you're having pain and it's been there for a while, we might do an x-ray of, let's say, your elbow, your joint, your shoulder, your knee, or even your back. If the pain continues to bother you, or it's been around for a while, or there's something very significant like weakness, then we may opt to do an MRI, which would be something indicated in those situations. What are the risks, benefits, and side effects of pain treatments? So we happen to be very lucky in the pain management field. And the fact of the matter is that there are very few risks and side effects to the injections that we perform. We decrease as much risk as possible by doing all of our procedures as sterilely as possible. We use imaging, so we'll use x-rays or ultrasound to make sure that we know exactly where we're going. And we try to minimize the amount of medication we give you to make sure that you don't have a adverse reaction to the medication. But by and large, it's very, very much well tolerated, the procedures. And I'm hoping that if you were to come to the office, we'd be able to help with any pain that you have with minimal side effects and minimal risks. What level of pain relief should I expect from your recommended course of treatment? So my goal is to completely alleviate your pain. Obviously, that's not always going to be possible, but I strive to do that. Typically, though, if we are trying to get your pain relieved, it's about 80% or more is what we would strive for. And that's typically what we use to kind of determine if we should repeat a procedure or an injection. And so I think that if you are the right candidate for a procedure or a certain pain regimen, we can get your pain considerably decreased. Are there any alternative therapies, such as massage or acupuncture, that I may explore? So I encourage patients to explore all kinds of modalities to be able to improve their pain. I think the best course of action for any patient is a multimodal approach that includes either medications, some sort of injections/procedures, and then, perhaps acupuncture or physical therapy or massage. And I think that patients are the best ones to know what will work for them by sometimes trial and error. Will lifestyle modifications such as diet or exercise help reduce my pain? Certainly, lifestyle modifications can be critical to helping you with your pain. Specifically, when we talk about giving you medication and doing procedures, we also talk about the importance of physical therapies to improve your muscle strength and to improve your typical diet to make sure that you're in the best shape possible. If you don't improve your muscles that are being stressed, you may continue to have pain. And so I always encourage my patients to try at least physical therapy in addition to the other treatment options that I offer.